Kearney County Hospital started in 1948 with the vision by the county board when the Seeley Hospital was acquired from Dr. H.S. Andrews. The Seeley Hospital was sold when the present facility was completed in 1954. Construction was made possible by taxpayers' bond and Hilberton funds. Later, in 1971, the hospital went through a major expansion, adding a new laundry, laboratory, radiology, offices, kitchen, and long-term care areas. In 1994, they changed the name to Kearney County Health Services with the addition of the medical clinic. The current hospital structural design layout makes it difficult to deliver efficient care because today's healthcare delivery system and needs are different from 56 years ago. Continued technology advances coupled with higher patient acuity and national standards of care make it imperative that we improve the architectural design of the facility. A modern patient care area will help retain and recruit a workforce of healthcare providers, provide a higher daily census, and open areas for further outpatient services. As with any 56-year-old building in the changing business, the current 20th century facility makes it difficult to provide 21st century medical care to the community. During the past few years, a number of issues and problems have been identified with the existing facility, especially in the areas that are part of the original 1954 construction. Some areas were or are being corrected as part of the master plan process and the fire marshal review. Those include a permanent CT room and a mechanical and electrical upgrade to a good portion of the existing space. Also, previous work has been updated to the existing backup generator, all electrical, and the heating and cooling system. But other areas still exist that were identified in the master plan. These areas of the building include patient rooms, emergency room size and entrance, waiting areas around the facility, fire sprinkler installation, creation of a main entrance, and space issues in a number of departments such as pharmacy, cardiac rehab, wound care, and specialty clinics. Specialty clinics really have no permanent space in the existing layout. Each specialty is scattered throughout the building and taken over abandoned patient areas for a growing segment of revenue. Patient rooms, due to size, age, and configuration of the space, are obsolete. They are set up for a double occupancy, lack air and medical gases, are not handicap accessible, and have no infrastructure to support modern medical equipment. The current ER department consists of one small trauma room and a closet. Again, electrical and air requirement for medical equipment is lacking. Finally, no waiting room exists for families during critical and trauma situations. Many other departments are in need of upgrades. Additional space and remodeling to include equipment and workflow required today versus 1954. The current pharmacy is very crowded and not centrally located to the nurses' station. The nurses would like to store more pharmaceuticals and be able to visually monitor the room and better track dispensing. Some past remodeling and construction projects solved only immediate issues without fully understanding the ramifications at the time. This has continued to create and foster workflow issues that need to be corrected. As stated, there is no clear front door. People have difficulty identifying the admissions area and locating the emergency department. Proposed new construction consists of the following areas to address the needs previously identified. The emergency department, including renovating the CT trailer area into a new garage bay, larger trauma area for at least 2, treatment area, and waiting room. Private patient rooms with ADA accessible bathrooms and medical gases, electrical infrastructure, and future IT capabilities. Land requirements are minimal and currently all owned by Kearney County Health Services. Additions to the building have been done to maximize the site potential and maintain a helicopter landing pad. Few, if any, problems are anticipated with the project due to recent work completed. Both the architectural and engineering team along with the construction manager have completed projects with Kearney County Health Services. This helps limit the probability of surprises that drive up construction cost. Also, the maintenance staff is very familiar with the structure, HVAC, electrical, and plumbing throughout the facility. Ten new private patient rooms similar to this one will be added, allowing room for a sleeper bed as well as an ADA-approved bathroom and shower. Ceiling track lifts are also scheduled to be installed in each room to assist the nurses in positioning and moving patients more safely. Remodeled areas include pharmacy, cardiac rehab, clean hold, wound care, specialty clinics, and various other department functions. We are now going east down the new inpatient hallway to the nurses' station. The new nurses' station will be located between the inpatient rooms hallway and the outpatient rooms hallway for ease of accessibility to either side. The pharmacy will be relocated directly behind the nurses' station also for ease of accessibility. As we are going west down the outpatient hallway, the areas that one will be able to access are the specialty clinic exam rooms, the visiting physician offices, the wound care room, as well as a new cardiac rehabilitation department. Four existing patient rooms will be renovated as exam rooms, such as this one, and will accommodate visiting physicians who provide outpatient care such as cardiac, orthopedic, urology, and ophthalmology. We are now going to proceed to the renovated area that will become the emergency department waiting room. The emergency room waiting room will be located just west of the renovated emergency room for the convenience of those waiting for a private visit with the ER physician. As we leave the emergency waiting room, we will move to the renovated emergency department. The renovated emergency room will provide 2 rooms to accommodate and allow more room for treating patients and also more room for necessary equipment in the ER, while allowing ER staff to move between the 2 rooms with ease as required. We will now visit the renovated area for the procedure room. The renovated existing cardiac rehab area will be the new procedure room, which will be located just across the hall from the emergency room, and used primarily for scopes and backup emergency room, as well as serve as a room for other outpatient procedures. As we leave the procedure room, we will proceed past the nurses' station to the inpatient hallway, which will take us back to the hospital and outpatient admissions area, and then we will exit the building through the main entrance. The current plans are well designed from a construction perspective and are straightforward and functional from a cost perspective. More importantly, they are designed from an end-user perspective to make efficient work areas for staff, including medical staff, and comfortable, accessible areas of use for the patients and the families for which it was designed. It is also our hope that when the renovation and new addition are completed, that the hospital building will move into the 21st century and provide a functional place to deliver care for years to come, as well as provide a comfortable and safe place to receive care and recover from illness. Once again, we are looking at the current areas of the hospital needing renovation or replacement that are not meeting the current codes and standards of care for inpatient hospital facilities. The only anticipated construction challenge will be maintaining operations during the construction of the new patient area. Beckenhauer Construction, the construction management firm, is working with Cannon Moss Brigger Architects and the Kearney County Health Services staff to ensure that the staging can be done to maintain a good construction schedule while maintaining operations. The lead architect on this project believes that the project is well planned and designed to ensure this is a long-term solution to the issues that have been identified, and recommends the plans be improved as presented. Alternatives and other options for patient upgrades have been presented and reviewed over the past year.